Okay. Now, Dr. Gatenby, you're looking at in your research the way of beginning to look at many of these cellular structures that are out here that we can begin to really target, really create targets for therapies. Now, you talked about the idea of our being able to develop a personalized approach to doing this. Would you elaborate on that a little bit more in terms of how you see this happening in the lab and then ultimately in clinical practice?
Sure. I think that right now what happens is that what are called biomarkers are used as a one-time therapy. So if your tumor expresses some biomarker, that's your sign to use a therapy. The problem with that is that once that therapy fails, as it always does, then the biomarker is useless. And so we would like to provide ways to guide therapy throughout the course of the disease where the biomarker represents a computational model, so a computer model that's always being updated by the data on the patient himself, so that there's a constant inflow of information as therapy causes changes in the cancer, some of them good, some of them not good, evidence of toxicity and so forth. And so just like a hurricane model that's always being updated by current data and then projecting forward into the future, that each patient will have this computational model that stays with him or her throughout the course of the therapy, always being upgraded. And so even when you go to second line therapy, third line therapy, the computational model is always there guiding what would be the optimal therapy for that